Welcome to our event. I'm part of Salus Fatigue Foundation. My name's Emily. We are a not-for-profit organisation which was established in 2009. We've just celebrated our 14th year, which was a nice thing to celebrate. It's essentially a central hub that brings together a team of qualified health practitioners, and each has their own skills. So they might specialise in nutrition, sometimes yoga. We've got hypnotherapists, we've got some counsellors. So it's really a space to bring everybody together. All of our team members and a lot of our health practitioners also have their own lived experience of fatigue and related illness. And we support those who have many different conditions that usually end up having similar symptoms. So that can be from ME, chronic fatigue, fibromyalgia, cancer, PTSD. We're currently running a project with DRC, so Steve, who will speak in a minute, on menopause, and obviously mental health, long COVID and post-COVID. So how do we help? We have a range of different services, some online, some face-to-face. Obviously, from what happened with COVID, it meant that we moved a lot of our work online, and slowly we are starting to open back up to being face-to-face again. So we do things like our support groups, we do workshops that have specific focus, such as this one, we do bigger events. And then some of our online services include an online wellbeing hub, which you can buy courses that have specific topics such as nutrition, or you can do a 90-day journey to wellness. We also have a closed community hub, which is where we put all of our online recordings. So it's a library of everything from webinars, short videos, sometimes there's blogs all written by our qualified practitioners. And then we have our closed Facebook group as well, which is a private safe space to speak for peer support with other people going through similar situations. So what is post-COVID? Now, obviously, we all know it as long COVID. It's now started to be called post-COVID, which can be quite confusing. However, the difference between the two is that post-COVID usually happens before long COVID. So it's usually just after you've had COVID and some of the symptoms that you'll experience then. And then moving on to long COVID, it's where it's gone on for longer than 12 weeks and you're still sort of having all the symptoms. So the symptoms can be fatigue, high temperature. It can be some mental symptoms that you can experience. Those symptoms may change and they do differ from person to person. And it's generally something that can't be described as having an underlying disease or condition prior to having long COVID. And that's a bit more information about the longer COVID that I was just talking about. So there is a stat there that's saying it's estimated 2 million people could now have long COVID, which is huge, really. And, you know, it was around before with fatigue, especially when we're talking about chronic fatigue and ME, but now they're starting to recognise it a lot more as long COVID. And you can see there it can affect any body part, both physically and mentally. So here are some of the common symptoms, but as I said, that can present very differently in a lot of people. Obviously, beforehand, we had a lot of people that had loss of taste and smell. I know I lost my taste and I certainly haven't got it back yet, covering all my food in salt, which isn't great. But now these are the most recognised symptoms. So obviously, as we mentioned, fatigue, headaches, chest pain, dizziness, those sorts of things. And a lot of those come with other problems such as brain fog and insomnia. So over to you, Steve.
Oh, thanks very much, Emily, and it's great to be working with Salus on this work as well. So my name's Steve Morley. I'm from Birmingham Disability Resource Centre, and just a bit about the work that we do. So we're a charity run by disabled people for disabled people. So 80% of our board of trustees are required to be disabled people, and that just ensures that disabled people remain in control of our charity and decision. They're the ultimate decision makers. And as you'd probably quite expect, 90% of our staff are also disabled people and 100% of our volunteers. So we're very much about disabled people having a voice for disabled people. We support people with all disabilities, including sensory, physical, mental, neurodiversity, and we also support people with long COVID and through our long-term conditions support work. We support over 4,500 disabled people each year, and we also support carers and family members. Well, we support them to take a full and active part in society, and based around that, we work to the social model of disability. And this is really important for us because that working to this model, it says our view is that society puts the barriers in place that prevents people from fully participating, rather than the disability and the problem lying with the disabled person. Very much about how we can change society in big and small ways to be more inclusive of disabled people. Next slide, please. Oh, next slide, please, Emily. Oh, thank you. So we have 6 main service areas, the largest of which is our information, advice and guidance service. And this is very much about getting people the benefits that they need, supporting them with debt, supporting with poverty, and also around navigating the health and social care system, including accessing the long COVID pathway. We also provide employment and training and volunteering support. That's very much about getting disabled people to where they want to be in terms of their employment journey. That might be getting a job, it might be volunteering, or it might be doing training. And through this, we also work with Salus around menopause as well, and keeping women in work and returning to the workforce. We also provide health and wellbeing services, including walking groups, and we run a health and wellbeing course, which is around giving disabled people the skills and the knowledge to improve their health and wellbeing. We also provide skills development, such as IT courses and staying safe in the community. And we provide social and leisure activities to bring disabled people together in things that they enjoy doing. And then finally, we also deliver some community development work, particularly in the Yardley constituency of Birmingham. So that's us in a nutshell. Next slide, please, Emily. So in terms of post-COVID and long COVID and health inequalities, I think fairly early on in the pandemic, it was identified that certain communities and certain groups were being proportionately impacted by COVID, including disabled people, certain ethnic groups, and those in the highest deprived areas of the country. And sort of nationally and locally, the NHS have introduced and adopted the Core 20 plus 5 framework, which is quite an NHS jargony. So if you break it down, the Core 20 is the people who live in wards that are in the 20% most deprived in the country. And just to give a bit of context to that, about 50% of the population of Birmingham live in the 20% most deprived wards. So that's well over 500,000 people living in some of the most deprived wards in the country. The plus is the groups that have been identified locally, where they may not reside in the most deprived wards, but they have certain characteristics, which mean they have poorer health outcomes than other groups. That's in Birmingham, that's people with learning disabilities, and in maternity services, one, and there's a few other. And then the 5 is the 5 areas nationally of clinical areas within the NHS that health inequalities can be addressed by accelerating improvement. And so what we want to do with these sessions is to raise awareness of long COVID and to work to reduce those health inequalities that people are facing. And from information from the integrated care system in Birmingham and Solihull, people who are currently accessing long COVID service are mainly females, mainly of the ages 25 to 64, and mainly from white heritage groups. And given that Birmingham is about 51% made up of from non-white heritage groups, it's quite clear that the people accessing the service are not, even on that measure, are not reflective of the population of Birmingham and Solihull. And so really through these, we want to raise awareness of this service so we can help people who are clearly struggling in the community alone. Thank you.
And if it's all right, I'm going to start the other way on. I'm going to start with the nutrition first and go to the breathwork, because as I know from previous experience, doing some of the breathwork exercises can make people a little bit tired. So it's probably the best way around to do it. It also corresponds better with my timeline in terms of what I've experienced. So I'm going to do it that way around if it's okay. So am I good to go with this?
Yeah, of course. Yeah.
Right. Okay. It was chronic fatigue that I had. It followed on from a flu virus in 2017, and the nutrition side of it seemed to work very well for me. But I have to say, it was largely accident. A little bit of intuition, listening to my body, a little bit of knowledge, some of which was dangerous, and some chance, really, bearing in mind where I was at the time, and that was that I was eating a very high raw diet, high raw, fairly vegan diet, I would say. And what I didn't know about it was that it wasn't entirely suitable for somebody who got chronic fatigue. And I very soon learned that I had to adjust it quite significantly. So rather than just tell you what I did, because I can certainly give you the short form of what I did, I was lucky in that a couple of years later, I was pursuing a nutrition education course, and I needed to write a paper. And I chose to write the paper on the effects of a raw food diet on chronic fatigue, fibromyalgia, and so on. I wanted to see what the reasons were behind my recovery and whether the shifts I'd made were a good idea. Did I need to make all of those shifts? Would it have worked without being raw? Those sorts of questions I wanted to ask. And I've come up with a number of I wouldn't say hard and fast results, but interesting things that I think are worth relaying, just because they seem to have the backing of science, and where they don't, I shall say so. I was actually ultimately eating, in the first instance, when I was getting over the flu, I was eating a high fruit and veg diet, and that was it, because it's all I wanted for about the first week. I couldn't take anything other than light vegetables and fruit. That's all I wanted. It progressed a little bit, but this made me alert to the fact that I probably had been doing things a little bit wrong. I hadn't been listening to some of the specialists I occasionally played in the background and half listened to, who was suggesting that I probably should be eating more fruit, because I'd fallen into that idea of fruit is full of sugar, therefore I shouldn't have it. And fat was fine. And it was fine for me because I was always thin. Why would I worry about fat? And it seems it did have an impact on me. So I started off by looking at 2 studies on fibromyalgia at the turn of the century. And these studies were on raw food diets specifically, and the outcomes. And they were quite different in that the first one emphasized what they called living foods. Now, it may well be that you don't even know what living foods are. Many people don't, and there's nothing wrong with that. It's not in common use. It really means foods like sprouting, so bean sprouts, seed sprouts, and so on, sprouted grains, juices, microgreens, so they're the little things, a little bit like cress, lots of different things like that. So you can make wheatgrass juice out of the grasses and so on, and fermented foods. They were the mainstay of this diet. The other was standard fare, really, the things you can buy from a supermarket. In each case, they had a kind of intermediate stage where they looked at results. And in each case, both diets were doing very well. People were improving on all sorts of markers, whether they were self-reported or measured by specialists. They were all improving in different areas. However, the overall outcome, when they tested the full outcome for each diet, were very, very different. The one where they had bought the fairly standard food from the local supermarket fared extremely well. The other one did not. And the reason was because adherence dropped. They stopped adhering to the diet. It was too difficult. So in many ways, the biggest learning from that was, don't make a diet so, it might be brilliant, but if it's so inaccessible that people can't do it, it's not going to work. And that's really key. So I think that's a really good place to start. But it was very interesting that these diets did have success. So there was something about, especially raw fruits and vegetables, because these were the mainstay, grains as well, beans and so on, in the case of the one that succeeded the most. So there was something about that seemed to work. So did it need to be raw? And now I would say that these 2 fibromyalgia studies speak in favor of it being raw, but they didn't test it any other way. So how do we know? I think there are some arguments against it, because there have been other plant food diets where it's been whole plant foods, where they've been used for specific purposes to overcome chronic conditions such as diabetes, heart disease even, and cancers. And they've been very successful and not raw. They've been a normal mix of cooked and raw foods, just as most people would eat. So although there's been nothing tested, as far as I'm aware, for chronic fatigue, fibromyalgia, long COVID, certainly not, because obviously it's new. I don't see why it wouldn't apply if it works well for heart disease, for diabetes, for lowering cholesterol and all those other markers. Why would it not work to support the body? Because this is really what's going on. I know there's a tendency for us to want to seek a magic bullet. There isn't one. It's actually bringing your body back into balance so your body has the chance to get well. And that's what these foods generally do. And that's why they work across a range of different conditions. Now, the big one was oil. I had previously been eating really a lot of oil, far more than I ever realized, because of course, if you look at a plate of food, you don't really see the oil. You see maybe a lot of leafy greens, I thought. So I got to oil. So I just think that is probably something to consider, and just be mindful of how much fat and oil there is in your diet, just because it is difficult to break down. It's the most difficult micronutrient to process. And so it probably is worth bearing that in mind. I have no absolute proof of whether it's useful or not. We do know from population studies where people lived healthily into their hundreds, the centenarians, they tended to have a high carbohydrate diet, which of course is not popular these days, but they were not eating industrialized carbs at all. There were no white carbs. This was whole grains, fruits, vegetables, and low fat in their diet. So I like to look to them, because I realize they've not had any kind of placebo trial attached to them. You can't do that. You can't have double-blind testing for that sort of experiment. There's no such thing. But it is interesting to see how other people have lived and what's worked for them. So I suspect the oil may be a consideration. But there is one big one I want to finish on this bit of the presentation, and that's, it's a little bit unknown. There's not much information about it, but it's the microbiome, and everybody gets very excited about the microbiome with justification. I think it's fascinating. What is known is that people with chronic fatigue, fibromyalgia, and long COVID, we know this now, have gut dysbiosis, which means their internal gut flora is not supportive of good health. Basically, they have fewer strains of bacteria and the other microbes that we need to have that are supportive of health. So that's fascinating, and it does mean there's a doorway to doing something about it. And the good news is, of course, well, maybe not of course, but the good news is that the good bacteria can be fed precisely by the foods I've just been talking about: fresh fruits and vegetables, whole grains, beans, a few nuts and seeds. So as many of those as you can get into your diet happily are going to support the microbiome, which will eventually, hopefully, flourish. If you're also happy and enjoy eating fermented foods, then give that a go too. So that would be sauerkraut, kimchi, but the ones that are not pasteurized. Drinks like kombucha, kefir, and one or two others that I can't think of at the moment. There are a few, but they're probably the most common. And they can be supportive as well. If they don't suit you, don't worry about it, because the fruits and vegetables literally do feed the good bacteria that will flourish. You can do it that way. So both ways seem to work. Now, I'm very happy to have any questions on this at any time. I don't have all the answers. I wrote this long paper. I found it very interesting researching this and finding out why I'd got better, because I did. I got better within about, I'd say about a year and 6 months. So I know that diet was the biggest intervention for me. So that had to play a role, I think. But how much and exactly what happened and how much it transfers to other people, I wish I could say, but unfortunately I can't. Now I'm going to move on to the breathing now, and I'm calling it breathing specifically, not because it isn't breath work, it is, but because the breathing that I do is about retraining breathing and getting us back to how we used to breathe. Because this follows on from what I've just said about the microbiome. Something else that seems to be very prevalent amongst people with long COVID is that they have dysfunctional breathing. Now, what isn't known is, did they already have dysfunctional breathing and that made the long COVID more likely, and even perhaps COVID, who knows? Or was it the other way around and that the COVID made the dysfunctional breathing happen? Talking to people and my own experience, because I had the good fortune to get this one as well, but in only one aspect of it, it would appear that dysfunctional breathing was probably present first and long COVID made it worse, or COVID made it worse. That seems to be what I'm getting from people, but that's anecdotal, of course. I did have this and I had the breathlessness. That's what I had. I didn't really have any other symptoms I had a little bit of the loss of taste for a short while. I was lucky not to lose it for a long time. But I didn't have other symptoms, and I'm hoping that's because I knew what I was doing in a dietary way, or at least that may have formed part of it. But the diet couldn't solve the breathlessness. There was nothing that it could do about that. I had to actually address it, and I didn't know I had dysfunctional breathing. Most people don't, and this is really quite exciting. And I say it's exciting because if you've got dysfunctional breathing and you've got long COVID, you can do something about it. It can be retrained, and it does make a difference to most people. And that's really what I want to talk about here. And I'll give you 3 reasons why the effects are quite as pronounced as I'm making them out to be. The first is probably the most obvious, and that is when you take in air adequately, when you breathe as you should do, your body, your tissues, your muscles, your organs will be effectively oxygenated. And if you think about that, if you're not breathing effectively and you're not getting that really good oxygenation, then that affects the organ up here as well, the brain. And we know full well that a lot of people experience brain fog as a result of any of these fatigue-related conditions. So oxygenation of tissues, that's a big one. Now, the slightly less obvious ones are stress, and I'm about to explain why stress can be so linked to breathing, and also sleep. And I think we know that stress, for example, can be involved in up to about 90% of all illnesses, which is huge. Now, that means it may be a part of it. It may even be a cause of it. So it's something to really get to grips with, because if your breathing is contributing to your experience of stress, then it makes absolute sense to do something about it and feel better. Sleep is huge, and I know a lot of people have sleep issues as a result of having long COVID. This seems to be a big factor for a lot of people, and it's likely that if they also have the breathing disorders that I've mentioned, then those two will go together. Let me explain why. I want to try and describe to you what dysfunctional breathing looks like. And it's really easy to describe, because I'm going to ask you to picture somebody at the point of going into a panic attack. What are they doing? They're breathing fast. The mouth is open. They're breathing hard. It's all upper chest. It's panicky. And that is full on dysfunctional breathing. At the other end, of course, everything is much slower, calmer, deeper breathing, and that's fine. We don't need to look at that. We know hopefully what that looks like, although we're going to get closer to it in a moment. But somewhere in the middle, many people, and it's not just people with long COVID by any stretch of the imagination, have this breathing that is between the two. It's a little bit too fast for what the body needs. And remember, you're doing this between 20 and 25,000 times a day. So to be doing too much of it is an issue. It just is. It's probably more important than food. And it pains me to say that because I've been immersed in food for so many years now. But I think it probably is. And you're also breathing harder than your body needs it to be. It will be shallow. It's upper chest. It doesn't get down to the lower lobes of the lungs. And if it doesn't really get down there adequately, then that oxygenation doesn't take place, because that's where it happens. It happens in the lower lobes of the lungs. And this isn't about big breaths, because if you think about it, somebody going into panic is breathing big and hard. And this idea that you're supposed to take a big breath when people say deep breath, because we tend to interpret it as big, is absolutely about as wrong as could be, because you're reinforcing that pattern that's already there. So that's one thing that I hope people will take away from this. It's breathing effectively. and always, always, always through the nose, because mouth breathing is fraught with difficulties. It has nothing whatsoever to offer to you, whereas the nose does. The nose will filter your air, it warms it. You also take in nasal nitric oxide, which is like a wonder molecule that people just didn't know about until the early 1990s. In most of our lifetimes, this has come into knowledge, and we know that it's anti-pathogenic, so it's antiviral, antibacterial. Breathe through your nose and help yourself to support your immunity. Really important. So if you're breathing too fast and too hard during the day, this is why it can contribute to stress, because if you look at it, if you in your mind's eye look at somebody breathing hard and fast, it looks stressful. It is stressful. The body is giving the brain a message that there's stress, there's something to worry about, there's something to deal with. Be alert. And that also can stop you getting to sleep. It can give you an agitated mind, or it can wake you up. The same thing, the breathing is too fast, it wakes you up. So this is what I'm focusing on here. And I want to enable you to take something away with you so that you can actually trial this for yourself. As said before, this is breathing re-education. So this isn't so much of an intervention, although it can be as well when needed, but it's much better to train this so that it's ready for you to use whenever, well, all the time really. So you retrain your breathing so that it gets better and better. And I'll start you off on this, and I'll ask you to try and keep it going for a few minutes. Ideally, it'd be good if you can keep going for about 5 minutes. And then while you're doing it, I will explain to you what's happening and why it may be making a difference to you, because that is obviously the motivation that can help you to keep going with it. Because motivating yourself to do this is the hardest bit. It is absolutely super simple, but easy is not always the same thing. And that's what I want to try and help with here if possible, and then answer questions if there are any. So at the moment, I don't know how anybody's breathing is. I can't obviously know that, but I'm imagining that it's like this, that you're breathing in, you're breathing out, you're breathing in, and you're breathing out. What I'm going to ask you to do now, and this has to fit you, because it's where you're up to. I have no idea where any of you are up to. I'm going to ask you to breathe in more slowly, and I'm going to ask you to breathe in less air. We don't just overeat, overthink, and overwork. We also overbreathe. So breathe in less air and breathe out gently, slowly, and as calmly as you can. And if you can make the exhale slower, then so much the better. You bring that down to a level you can cope with. So it's a slow breath in and a soft, relaxed, and gentle breath out. So you need to be sitting upright. This needs to be through the nose. And it's a slow, soft breath in and a soft, relaxed, and gentle breath out. And these small breaths will get down to the lower lobes of the lungs. So if it helps, if it makes any difference to you, the other thing you can do, I'll try and get in view with this. You can put one hand on your chest and one hand on your abdomen, just kind of above your belly button or underneath your ribs, just about on the end of your ribs, if you like, where your diaphragm is. And just feel your breathing. Don't worry about what it feels like, but just feel it. It kind of helps with the relaxation. This should be relaxing. It won't be relaxing if you overdo it, if it's too much for you. You may go into stress, in which case take a break and then go back and try again after about 10 or 15 seconds. So I'll start you off again, just to complicate things. Now everybody's breathing beautifully. And then I'll explain what's going on. So just a few moments of this first. So a nice, relaxed, gentle breath in, and a slow, relaxed, and very gentle breath out. A slow breath in, and a soft, relaxed, and gentle breath out. And a slow and smaller breath in, and a soft, relaxed, and gentle breath out. And a slow breath in, and a soft, relaxed, and gentle breath out. A slow breath in, and a soft, relaxed, and gentle breath out. And a slow breath in, and a soft, relaxed, and gentle breath out. Now, I'm going to ask you to keep that going. And if you've got your hands there, keep them there too. So keep that going. And I'll explain to you what is happening and what that should feel like. You ideally should feel that you would like to breathe a little bit more. So it's a kind of air hunger. It's not, it's getting towards suffocation, which of course sounds horrible, but you will understand what I mean by that. It's not the most pleasant feeling, but if it's not stressful to you, if it's tolerable, then you've got it absolutely right. Because what's happening here is you're training your brain to reset. Because at the moment, if you are breathing too fast habitually, then your body is no longer, it's too sensitive to the buildup of carbon dioxide in your blood. And whilst everybody thinks of carbon dioxide as a waste gas, which it is, it plays far more of a role than just being a waste gas. It's not something to just get rid of and wish there was none there in your body. If you had none in your body, you would not breathe, pretty much, because it is the first stimulus to breathe. So when the sensitivity reaches a certain point, then the carbon dioxide is the thing that builds up that sensitivity, and the trigger, it comes then to breathe. The problem is those of us who have dysfunctional breathing, the trigger comes too soon, and that's why breathing is fast. So this training is to get you used to breathing less and being able to cope with it. And it takes practice, but that's all it takes. It just takes practice, regular practice. So really, this is a build-up of carbon dioxide that you're hoping ultimately you can allow a little bit more in to get back to normal levels, so that you're breathing as you did as a baby. We all got it right as a baby, and animals tend to as well. You don't see animals other than dogs, and that's usually when they're hot, breathing through the mouth, for example. So this should all be absolutely through the nose. That's non-negotiable unless there's a physical reason otherwise. So building up that carbon dioxide is also a relaxant. So you may feel relaxed, even though you may not enjoy the sensation of breathing a little bit less than you're used to. But there's another thing, there's another little clue you may have. And don't worry if you don't, it doesn't necessarily mean you're doing it wrong. But if you check in your mouth, how does that feel inside? Have you got more or less saliva than you had before? Very often when people do this exercise, if they're getting it right, they usually feel more saliva. And the reason is that even though we don't particularly like it, because I like to breathe a bit more, I'd like more air in, that feels normal to me, the body's perfectly happy with it. The body's so happy with it, it could digest food and it's ready, and it's telling you that by virtue of the saliva that's there. The other thing that can happen, and this is a nice little bonus as well, for those of us who tend to feel the cold a lot, it may be too that you're getting better oxygenated by doing this. And that will spread out to your fingers and your toes if you're lucky. And I say if you're lucky because this doesn't work terribly well for me, but I know it does for a lot of people. And it does when I get to bed, because this exercise is a perfect one to do either before you go to bed or directly before you go to sleep. And to do it for about 15 minutes to really give yourself the best chance of falling asleep and to have good quality sleep, because both are just as important as each other. The carbon dioxide, another benefit of it is that it's a dilator, so it actually helps you to breathe better. So if you have been breathing habitually quite often through your mouth, as do a huge proportion of the population, so no berating yourself, there's nothing wrong, but you will find as well that the more you use your nose, the more it will dilate and it will get easier. So use it or lose it is the saying. It works in the case of this in the nose. So if you're still doing the soft, gentle breathing, let me tell you what else is going on here. By doing this slow breathing in particular, the slow part of it, you're slowing down, and it stimulates the relaxation response. And part of that relaxation response is a nerve called the vagus nerve. And this is a huge nerve that wanders throughout the body. And it links up the body and the brain, and it gives messages from the body to the brain mostly. Some messages go that way, but 80% go that way, body to brain. And in doing this, you're likely to reduce anxiety and depression. It's known that stimulating the vagus nerve frequently reduces anxiety and depression. It reduces inflammation, which is a component of so many illnesses. It helps with the production of melatonin. And if you've heard of this, this is the sleep hormone, it's often referred to as, but it's much more than that. So even if you still can't sleep by doing this, I would recommend doing this exercise anyway to produce the melatonin, because it's part of our immune response. It's a hugely important antioxidant. Also, one of the big benefits of sleep is this whole thing of the cerebrospinal fluid cleaning your brain. And if you don't sleep, then of course you worry that that's not happening. However, if you stimulate your vagus nerve, which you can do by this nice, soft and slow breathing, then that happens. It actually happens. So it builds back some of what you lose from sleep, which is also good news. Additionally, it triggers a neurotransmitter called acetylcholine. The name doesn't particularly matter, but that slows heart rate. So that's why this can be useful to do as well. If you're feeling a little bit agitated, a little bit panicky, take yourself to one side, sit down and do some slow breathing if you can. You don't necessarily need to do the hands because you may have people around you, but nobody's going to notice if you're just slowing your breathing down and reducing it a little bit. Doing this practice also increases what is known as your vagal tone. And this is a bit like working on muscles, and it doesn't disappear. That's the great thing. It's not something that as soon as you stop, the effects have gone. The effects remain, and they're there to support you throughout your day, which is really good news, I think. What else is there? One more. It will also, triggering the vagus nerve works on what's called your baroreflex. And this is receptors in major arteries in the body, which have a role in things like blood pressure. So to keep your blood pressure where it should be. If something raises your blood pressure, it will act accordingly to bring it down. And if your blood pressure is too low, it will help to bring it back up again. So many good things. And I've just mentioned a few of them. So I'm hoping that you feel inclined to have a go at this. If you're really keen and you really want to retrain your breathing, I know it's only one exercise of many, but it can make a difference if you do it about 60 minutes a day, broken up, 5 minutes at a time, 10 minutes at a time, the big chunk before going to sleep, if you can do that. And always, always, always breathe through your nose and become more aware of any mouth breathing. It's common, loads of people do it, nobody thinks about it, but it makes the biggest difference possible to so many people. So I think that's it for now. So thank you for being with me.
Thank you so much, Annette, for that wonderful piece on nutrition and breath work. I know there'll be some questions at the end, but we can save that until after. We're just moving on now to the services available. I know there's a lot of frustration out there that is around the lack of services, but a lot of the time that can be just from not knowing that they're there. Part of this fund is for us to show you what is there. So the Birmingham Solihull service started in January 2021, which was the first post-COVID assessment service. They essentially set it up to help anybody that is in need of treatment following on from having COVID. They support patients from 16 and upwards. However, it's very different for those who are under 16. The service provides a lot of physical, cognitive and psychological assessment and then further rehabilitation to help with the patient's recovery. They do work in collaboration with other services such as to support a system-wide approach and support as many people as possible. So in the next slide we're going to visit, it's going to show a couple of links of where you can get support that they have set up. So as you can see from this slide, there are two links on the screen and a QR code. They will basically take you to the service that the NHS is now offering and has been for the past year or so, and developing it as the research is going on. The first link will take you to their website where you can find out more information about COVID, post-COVID and what is happening. And then at the top right hand corner you will see something called Your COVID Recovery. When you click on that, it will take you to a page where you can look at more in-depth information around what you're going through specifically. So as part of this being able to be delivered to you for free, it's part of the fund's requirements that we have this SurveyMonkey form complete. So whether you're watching live or whether you're watching on the recording, please can we ask if you complete this really short SurveyMonkey form. It just helps us be able to continue to deliver these services for free, and also helps the NHS to develop their services to be able to suit the needs of everybody. So you can do that by typing in the link on the screen, or you can follow the QR code. Thank you so much in advance to everybody who does complete that.